do I like to float? No. Everything is different, like everything. Hey guys, welcome back to my channel, and if you're new here, hi, my name is Alexis. Don't forget to subscribe. So I know it's been a very long time since I've made a video about nursing. I know I've been slacking, so sorry about that, but today I am finally back with another nursing video. And so for those of you who know, I work in the NICU, but today I will not be talking about the NICU. I will be talking about the Pediatric Intensive Care Unit, aka the PICU. So let's go ahead and get started. So the reason why I'll be talking about the PICU today is because as a part of my job, I have to float there. So last year when I was being interviewed for my current job, it was explained to me that part of my job description would be floating to the PICU. And so this was actually pretty new for the new grad program that I'm in. It used to be that the NICU was a closed unit, so no one ever floated. And then they changed it so that new grads had the option of, yes, I want to float to the PICU, or no, I don't want to float to the PICU. So for my group that came in August of last year, we were the first group that absolutely had to float to the PICU, no exceptions. So that was explained to us, and we agreed to it when we signed up for the job. So for the first 9 months of our job, that is the probation period, so we didn't have to float at all for the first 9 months. But towards the end of those 9 months, that's when we finally started doing our cross-training and orientation in the PICU. So orientation lasted for 6 shifts. So we did 6 full 12-hour shifts in the PICU. I actually had 3 different preceptors, and my days were all day shift. So I didn't really get to experience what night shift was like in the PICU. And let me tell you, the PICU is very different from the NICU. When I was in nursing school, I of course did my preceptorship in the NICU. I also did a shift in the neuro ICU, and I did a shift in the PC ICU. But I never got a chance to go to the PICU when I was in nursing school like some of my classmates did. So I really didn't know what to expect, but I figured, okay, it's pediatrics and it's ICU. You know, it'll be a great experience, something good to put on my resume, and just a way to learn new things. But let me tell you, the PICU is so different from the NICU, so different. I can't even begin to explain. So one of the first big differences is, obvious, the population. Where I work in the NICU, we only take care of babies. However, in the pediatric ICU, you can have a newborn, or you can have someone all the way up to the age of 21. So that was pretty different for me. It's been a very long time since I've had a patient that was, big to the point that I couldn't just hold them in my arms. It was a long time since I've had a teenager patient or a patient in their 20s. So that was very different for me. When you have patients in the PICU, you really have to interact with them. Like with the kids, you have to say, oh my gosh, I just love your SpongeBob pajamas. Like, what's your favorite color? Or I work in the NICU, I don't have to do that because, of course, my patients don't understand anything I'm saying. So, of course, I will talk to my newborn patients, be like, oh my gosh, you're so cute, but they don't understand. Another big thing, as, being part of the different population is when I'm in the NICU where I work, if I have to give a patient immunization, I can just whip out that needle, the baby will see it, and they have no idea what's coming. However, in the PICU, when I have an 8-year-old patient and they see a needle, they're gonna freak out, okay? They're gonna cry, they're gonna be running everywhere, trying to get out of bed. So that was just something that I had to get used to. Another big difference from where I work in the neonatal ICU versus the pediatric ICU is that each patient has their own room. So in the NICU where I work, we have pods, so our patients are like really right next to each other. But in the PICU, of course, they have their own room. So that was different for me too, having to go from one room to another room across the hallway. And then when the monitors are going off, I can't tell if that's my patient or someone else's patient. So that was a little different, and that's something I had to get used to. Another big difference is the charting. Charting in the PICU is a lot different from where I work in the NICU. It's a lot more tedious and repetitive. Also, you have to do rounds on your patients every 2 hours, but where I work in the neonatal ICU, we only do our care time for our patients every 3 or 4 hours. So I felt like I was a lot more busy in the PICU, just running from room to room and then charting, and then like next thing I know, it's time to do my rounds again. So that's a lot. Another difference is the medical conditions that you may see. Where I work in the neonatal ICU, I see things that are basically pretty specific to newborn patients. So I may see like gastroschisis, hypoglycemia, PPHN. However, in the PICU where I float, sometimes I will see things like lupus or diabetic ketoacidosis. Sometimes we have patients there with gunshot wounds, so very different from what I'm used to seeing. So let me tell you, it's been a long time since I've had a patient with lupus, or since I've really had to read up on it. So when I'm having all these patients with different conditions that I'm not used to seeing on my home unit, I'm just like, oh my gosh, I need a refresher. I have to look it up on the computer to make sure I have a better understanding of what's going on and what I need to do as a nurse. So those were just a few examples of the differences between the NICU and the PICU, but basically what I'm trying to say is that everything is different. Like everything. The way they stream fluids is different. They actually push meds down there. We don't push meds at all in the NICU, so that's different. And it's just the way they do rounds is different. I had the fellow ask me a question and I was just like, what? I felt like a complete idiot, because where I work in the NICU, we never discussed that, or I've never like heard that term, so I didn't know what he was talking about, and I just looked like a deer in headlights. So it's just a lot to take in, and my experience floating on the PICU has really made me have a new respect for PICU nurses and for flex nurses who float from unit to unit to unit. Because you have to get used to the way they do things in different units. You have to get used to the way, to where things are, and just everything. Like, I just can't imagine floating to different units. That just blows my mind. So shout out to all the PICU nurses and flex nurses out there. So the end of my probation period was towards the end of April, beginning of May. So that's when I did my cross training in the PICU. So I did my 6 shifts there. And then I went back to the NICU for 1 day, and I kid you not, the next day that I had to work, I was floated to the PICU. So I was the first person among my new grad group to float to the PICU, and I was freaking out, and it was on night shift. And like I said before, I didn't get an orientation day on night shift like some of my coworkers did. I did strictly day shift orientation. But luckily, my first patient, the first day that I had to float to the PICU, I only had 1 patient, and it was a patient that I was familiar with, who had been in the NICU quite a few days. So thankfully, I knew this patient, and I only had 1 patient that night. So overall, I was extremely nervous. I went from being nervous to comfortable to nervous to comfortable. It was like a cycle. But I survived, my patient survived, and that's all that matters. But another difference is that patients who are intubated in the PICU are usually sedated. So they have the sedation protocol that they follow. You give boluses. We don't really do that in the NICU. When our patients are, intubated, they're not really sedated unless they just came back from surgery and we know that they're in pain. So my patient that I had that night was intubated, and I kid you not, whenever his heart rate would hit like 160, which is perfectly normal for newborn patients, the PICU nurses were like, oh my gosh, you need to give him a bolus, he needs to be sedated. And I just felt like I was doing something wrong, because in the NICU, we don't worry about stuff like that. If their heart rate is 160, that's fine, because like I said, that's normal for a baby. But in the PICU, they're like, you need to sedate him. And I was just like, like, okay, I'll give him a bolus. So it was just very different, and I was nervous, but it wasn't too bad. The second time that I floated to the PICU was a few weeks ago, and I had 2 patients that time, but it was during the day shift, and thankfully it was 2 babies. So when we have nurses from the NICU float to the PICU, they try to give us patients that we're used to. So they will usually give us newborns. And thankfully I had 2 newborns that day, and one of them, once again, was a patient that I had several times in the NICU, so I knew that patient already. And the other one was a patient I didn't know, but it was also a baby. And that shift was great. Like, I felt comfortable. I felt confident. It was a really great shift. So if I had like all my shifts on the PICU go like that day, I would have no problem floating to the PICU. It was a really good day. So I'm sure you guys are wondering, what are my overall thoughts on floating? So overall, do I like to float? No. Because just think about like the Wizard of Oz. Dorothy always said, there's no place like home, and that is so true. When you're used to being on your home unit, you already, you have a routine, you know how things go, you're comfortable. But when you float to another unit, it's just like, I don't know, I just get really anxious and nervous. I don't know what to expect. I don't know if I'm doing things right. So I honestly am not a big fan of floating. However, I knew what I signed up for. It's a part of my job, so it's something that I have to do. And we are expected to float basically whenever they need us to. We're not supposed to float more than once a pay period, so no more than once every 2 weeks. However, things happen. But like I said, I got off, I finished my orientation in the beginning of May. It's now July, and I've only floated twice so far. First time was okay, second time was a really good shift. But it's just something that you have to do. And I will say that floating has really made me realize that I picked the right unit for myself. Like, the NICU is where I need to be. I made the perfect decision. I love the NICU. I'm so happy that I'm working there. However, I am thankful for the experience of floating to the PICU, but let me tell you, I love my newborn patients. I feel like that's really where I belong, and floating to the PICU has confirmed that for me. So I don't want this video to make anyone, scared to float. If that's part of your job description when you go for an interview, just keep an open mind. You never know, you might like it. You may be like me and think that you just want to work in the NICU, you don't want to work anywhere else. But if you have to float somewhere like the PICU, you never know. You might end up loving it, and you may realize that you actually want to be a PICU nurse instead of a NICU nurse. Also, if you float, just keep in mind that everyone on that unit is going to help you out. Like, when I go down there, they're so helpful. They always ask me if I need anything. If I have questions, I have a bunch of people to go to, so don't worry about getting help. But one thing that I do want to point out that is super important is that if you float somewhere and you get an assignment that you're not comfortable with, make sure you tell the charge nurse. There is no reason for you to accept an assignment that you're not comfortable with. If you feel like it's a safety issue or that you just can't handle your assignment load, let somebody know so that they can switch you out with someone else, because at the end of the day, it's your license that's on the line, and you don't want to cause any harm to your patients. Another thing that I do want to point out is that where I work at the NICU, we do have 58 beds. In the PICU, in my hospital, there are only 20 beds. Despite this, for some reason, we do have to float very often. I've only floated twice so far, but I've heard from some nurses that I work with that they float there like once or twice a month, which is not the greatest. I don't think anyone is honestly too happy about that. So it is a little confusing for me as to why they need us to float so much when there are only 20 beds. I understand that it is a very critical unit, and they do have a lot of one-to-one assignments, which is understandable, but it just is surprising to me that we have to float so much, yet we, having 58 beds, rarely have people float to us. But like I said, we signed up for it. It's part of our job, so we just have to suck it up and hope for the best. So that is it for this video. I just wanted to let you guys know that I do float sometimes, and I wanted to give you guys my opinion on it and talk about my experience a little bit. Like I said, keep an open mind if you do have to float to another unit. You never know, you might like it. And just to be aware that when you do become a nurse, that you just may have to float depending on your unit. So that is all for today's video. I hope you all have a lovely day, and I will see you in the next one.